I'm Dr. Msokwa. I'm here to share with you a study which I did on diagnosing triplets using ultrasound scanning. It worked for me and I hope it will also work for you. So be attentive. Apply this, it will work for you. Let us start. There are 4 methods or strategies which you can use for diagnosing triplets using ultrasound. The first approach is to use the fetal head, that is the head of the fetus. Divide the abdomen of the mother into 4 quadrants. Look for head in each of the 4 quadrants. If you are lucky, you may get 3 or maybe 2 of the head in each of the quadrants. Right? Once you have done and you have found the head, number them and locate them. If you have got a printer, print it to help you. This is for your own safety and for legal purposes. The second method or approach for diagnosing triplets is to locate the heartbeat of the fetus. How many heartbeats are there? Try to follow the head. Go to the neck, then to the chest, and note the heart of each of the 3 fetus. Right? You can use Doppler ultrasound scanning if your machine has got it, or you can just observe it. And be careful to differentiate between the beating of the heart and the pulsation of the aorta. Okay. After you have located the 3 heart beating of the fetus, you can go to the next step. This will also help you. The third step for diagnosing fetal heart is to check the membranes. The membrane of the mother, in short. Membranes appear as septum and they are floating in the amniotic fluid. In other words, the membrane, you can relate it to the sign of Mercedes Benz. Those 3 star-like, they meet on one point. Or those of you who don't know the Mercedes Benz sign, you can use it, or maybe you can relate it with the aortic valve cusps, the 3 valve cusps, the left, right, and the other. Okay. So the membranes normally appear the same like the aortic valve cusps or a Mercedes Benz sign, and they are floating in the amniotic fluid. On ultrasound scanning, these membranes will appear hyperechogenic and the amniotic fluid will appear hypoechoic. Right? Once you have noted the membranes, you are sure that these are triplets, the 3 membranes, right? But if it's still more, you don't doubt. This 4th criteria which you can use for diagnosing triplets, that is, you note the placenta and number. Check how many placenta are there. You can do this by checking from the fundus of the uterus, then anterior, then posterior. Finally, you can check it inferior, and if there is any sign of placenta previa covering the internal also of the cervix. Okay. So once you have done this should be like reinforcements for you to know that these are triplets. I hope you have got me right on how to diagnose triplets. In summary, there are four approaches for diagnosing triplets. The first approach is to use the head of the fetus. The second approach is to locate the heartbeat of the fetus. How many heartbeats are there? And number them, record them, and the position where they are. The third approach is to use the membrane of the mother. That is, their pouches. They are hyper-echogenic, floating in hypoechoic fluid. The fourth approach is to use the placenta, right? Check the placenta, how many are there. I will repeat this so that you may not miss and you may not have problem as I got during the first time when I made these cases on my own. I don't want you to have problem which I faced, but it worked for me after following those three features. So the first approach is to use the fetal head. The second approach, the heartbeat of the fetus. The third approach, the fetal membrane. The fourth approach, the placenta. Thank you so much for listening. If this was my study, you are welcome for any criticism, comments, and how I improve it. I am Dr. Robert Msokwa. You can email me on lobmsokwa@yahoo.com, or you can also check me on my Facebook, my Facebook page. I'm there and you get more. My presentation and even my article. Thank you so much for listening. Goodbye. I do love you all.